Dr. Ríos, what's the treatment for the symptoms of the long-term COVID syndrome?
There is a very frustrating issue right there because there's not a lot to treat them for. So there's no treatment for long COVID. We only treat symptoms and supportive care. That sounds horrible because we don't have the research yet enough to find out the cause for the long COVID so we can actually treat it. There's a lot of studies right now ongoing on biological basis of the symptoms so we can target the mechanism and stop the symptoms. As you can see, there's many protests everywhere in the world because despite we were able to pretty much manage the acute phase contagion and the people who were dying, now we're faced with the long COVID. And it's devastating because it's causing a lot of burden. People missing work days, people not able to do their life the way it's supposed to, the quality of life goes down. There's a lot of issues with this long COVID. So there's a lot of money getting into finally research for the long COVID syndrome. So what do we do for this patient? The medical goal for this is do a comprehensive rehab plan. Second, we try to improve the conditions that are associated with the long COVID, diabetes, hypertension, etc. We control them better. Holistic support can also be given, is shown to be beneficial. When you have orthopedic issues and muscle weakness, neurological, we do a lot of post-COVID rehab. You have a lot of people that, physical therapists, psychological people with psychologists and psychiatrists that can help you with the psychological issues or psychiatric issues. So a physiotherapist can be a lot of help, rehab. And nowadays, everywhere in the world, is starting to appear these post-COVID clinics. These post-COVID clinics is a multidisciplinary clinic that treats everything related to post-COVID syndrome. What do? Like in this case, they have an assessment initially from a pulmonary doctor, cardiologist, and a general physician or an internist who oversees the whole body. After they do a complete physical and doing blood tests and x-rays and everything, they can come out with a diagnosis of long COVID. They do also a physiotherapy consultation, a nutritional consultation, and important mental health assessment and counseling. So they do all this together in these clinics. They've shown that they've improved quality of life. People get back to their jobs. They try to get better, faster to their usual health status. So, long COVID syndrome, vaccination. A lot of people ask about vaccines.
For people that are vaccinated but still get COVID, like a lot of people at this time in the area here, do they still have issues with all these symptoms?
Very good, very important question. A lot of people, they've been anecdotal cases where people get vaccinated and they develop symptoms similar to COVID, or people who are vaccinated and they will be more prone to develop long COVID, or they have partial vaccination or no vaccination. What are the chances? All this is a lot of information out there that they need to clarify. First of all, the vaccine. Every individual responds different to the COVID recovery when they're vaccinated. Long COVID does not appear to be related to how severe the COVID-19 infection was, which I already told you that. And very important, people who are unvaccinated are more likely to experience long COVID than those who are fully vaccinated. This is important data. This is from the UK, and they tell you that if you're vaccinated, the chances to develop long COVID syndrome are much less than if you're not vaccinated. Now we're facing the 4th vaccine right now. I don't think too many of you have the 4th vaccine. Most of us have this complete vaccination and the booster. I personally have 2 Pfizer for the initial treatment and then the booster of a Pfizer. In Mexico, it's very hard to find all the vaccines. A lot of people have AstraZeneca and other vaccines. It doesn't matter. Get fully vaccinated, please. And there's a lot of controversy on the 4th vaccine because we're seeing a lot of side effects from the vaccine. In the initial vaccination, the protection that you get from the vaccines run between 80 and 90%, with the best protection from Pfizer and Moderna. But it doesn't matter. Any vaccine will give you better protection than none. Nowadays, with the new wave, the vaccination doesn't protect up to 50%. So the efficiency or the efficacy of the vaccination is not as good as it was at the beginning. A lot of it because we're already vaccinated and some of us already got sick. So a lot of people think about the risk benefit of getting the full vaccination. The CDC and the World Health Organization still advise us to get our full vaccination. So the best way to prevent post-COVID syndrome is to get vaccinated. And the best way not to get post-COVID is not to get the disease itself. So hand washing, distancing, and protection are the most important things. So if you don't get COVID, obviously you will not get the post-COVID syndrome. But if you get COVID because you're in contact with a lot of people that you will get it someday, the best tool is to get fully vaccinated. Now there's a lot of campaigns right now, a lot of places, the Navy Hospital, La Lija, other places, they're giving the vaccine all the time right now. So please get fully vaccinated. Best way to prevent getting long is to not get COVID. Again, long COVID, shortness of breath, fatigue, pain, anxiety. Vaccines reduce the chance of getting COVID up to 85%. That was at the beginning. Vaccines, this is an important number, reduce the chance of developing long COVID by about 50%. So if you have one vaccine or two vaccines, get the full vaccination, please. New research, again, double vaccination, this is at the beginning of the year, has the risk of long COVID. Don't miss your shot in order for us to stop COVID, please. And don't do it just for yourself, do it for the whole community. So, long COVID may be far more common than anyone thought about it. So we'll see it. We blame it on COVID for a lot of things. Please seek attention if you do think you have it. Research, advocacy, and education. Thank you.
I have a few just kind of general questions. Yep. I know they're ones that you'll know right away. Can you remind us how long somebody is contagious? Let's say I test positive for COVID today. How long am I contagious?
Normally, according to the CDC, the contagious time usually happens within the first 5 days, about 90%. If you recall, in the old times, we used to keep isolated people for 14 days when they have mild to moderate disease. Then it moved to 10 days because we knew that the first 5 days, 1 day, 2 days before, and 2 to 3 days after the positivity of the test, you were infectious. So because we knew that very few people will be still contagious after 5 days, in the US, they go down the isolation for 5 days in fully vaccinated people. Nowadays, we know that if you get in contact with somebody with COVID and you're fully vaccinated by the CDC, you don't need to isolate yourself unless you develop symptoms, okay? But if you have symptoms or you have a positive test, the actual data from Mexico is 7 days. In the US is 5 days.
Okay. And just in your opinion, or what have you seen, how many times can someone get COVID?
I've seen patients with 5 times COVID.
Even vaccinated?
Even vaccinated. And some people got vaccinated to 20 when we didn't have the 2020, when we had the vaccine. They got the first shot, they got COVID again. They got their second shot and they got COVID again, but it was very mild. And then I have a patient that since the last one, he had it 3 times. 3 times meaning that they got sick, they were positive, they recovered. There was a time that happened before that, they got symptoms again. In the interval, they were negative. We tested again, they became positive again. PCR. They got symptoms, they got better. Again, PCR positive, PCR negative, and then PCR positive again. So when you're vaccinated, it doesn't protect you 100% to get the disease. What we're trying to look for is the severity of the disease. We want you to have a mild disease and you recover fast, get back to your life.
Another question about vaccines. What do you see in the future? Are we going to get yearly COVID vaccines like we do for flu, or how is that going to work, and when would it start?
The US already started, of course, with the 4th vaccination. We haven't done it yet. We're pretty close to start with the 4th vaccination after everybody gets their full vaccination with the booster. Because the mutation of the virus, and we know that your immunity is temporal, it's not continuous. In the old times, we talk about 4 to 6 months. Now we know it takes a little bit longer. So every 6 months to every 12 months, we'll see that the government was going to start advising us to get a new booster. I don't think it's going to go away in the near future. We're going to continue to vaccinate at least once or twice a year for this disease. And make sure that follow the recommendation, especially if you're a high-risk patient to develop COVID, severe COVID, or post-COVID syndrome. If you're obese, if you're elderly, if you have diabetes, hypertension, you need to follow the guidelines from the government.
Okay. And just kind of in summary, so let's say that somebody around here has this type of symptoms that you discussed today. They can make an appointment with you.
Correct.
And then you go through, what are the steps that
Correct.
you go
If you after this conversation, you see that you fit into the criteria for long COVID syndrome, again, it's important to rule out alternative diagnosis. We need to do some basic blood tests, physical examination, a full medical examination. And then we sometimes can come out with other diseases than COVID. We can help you. We can treat you and you get better.
Okay. So again, if you have any questions, you can call the hospital, make an appointment. They can
Correct.
contact me. I can set that up. So thank you. This was great. And I was just sitting here thinking about, it's been 2 years since we did when all this started. And at that time, I think there was only like 1 or 2 patients. You, all of us here had no idea what was headed our way. And looking back, as you well know, it was a horrible, horrible time.
Yes.
And everybody always, appreciates what you did, all the doctors and nurses and everybody, and I hope we never have to go through that again.
I hope not.
And anyway, thank you, Dr. Rios. It's
You're
very
welcome.
good. And again, anybody has questions, they can let us
Please.
know.
We're here at Hospital Joya, and we have 2 hospitals, one in Nueva Vallarta, one here in Vallarta. And we have an open ER all the time. We have consultations. We have an outpatient clinic. So there's many ways to reach us. You can go to Facebook or their social media. But please, please contact your physicians in case you develop any symptoms or you feel that you have this long COVID syndrome. Thank you.
Thank you.